Thank you all for joining us for Thursday at noon. We're delighted to have Dr. Cassandra Fowler with Harmony Animal Hospital, who's our guest speaker today, and we'll introduce Dr. Fowler in just a few minutes. And as we begin, if everyone could just check your microphone, make sure that you're muted so it doesn't interfere with the audio. If you have questions during the presentation, you can type them into the chat, or Dr. Fowler will take questions at the end of the presentation. So Thursday at noon these webinars are sponsored by Fairfax County Economic Development Authority. They have collaborated with other jurisdictions in Northern Virginia to develop the Work in Northern Virginia website. And this is a great resource for people who are looking for jobs in the area, if you know anyone that was laid off at some point, or a resource for employers also to post jobs. And I'd like to recognize the Chamber's strategic partners. These are businesses that support the Chamber on a higher level, and we appreciate their support and want to recognize them. So coming up in August, we've got a couple of events. We were talking a little bit about the Cedar Knoll networking event next week. That's going to be in person. We did one in-person networking, our first one last month, and that was a lot of fun. We had a really good turnout, and we're hoping that people will come and support Cedar Knoll Restaurant right there on the beautiful Potomac River. They've got a great location. And then on August 19th, we were fortunate to be able to get Dr. Scott Brabrand, who's the superintendent, Fairfax County Public Schools, to come and talk to the Chamber about what school is going to look like this fall, the 5-day in-person learning for students, and how COVID has changed Fairfax County Public Schools. So that should be an interesting conversation. I know a lot of businesses are concerned about that in terms of their employees and parents, in terms of their children going back to school. So as I mentioned earlier, Dr. Fowler is our guest speaker today, and I want to tell you just a little bit about her before she begins her presentation. Cassandra was born and raised in Lexington, Kentucky, and she graduated from the University of Kentucky. She moved to Virginia and attended the Virginia Maryland Regional College of Veterinary Medicine and graduated in 2005. And she went on to practice at other companion animal clinics in the Northern Virginia area. And then in 2019, with the help of a fantastic team, she was able to realize her lifelong dream of opening her own veterinary practice. And she is excited to share her compassionate, competent, and fear-free style of veterinary medicine to companion animals. She is a fear-free certified professional and is proud to provide care in the first fear-free certified practice in the Northern Virginia area. So welcome, Dr. Fowler from Harmony Animal Hospital. We'll turn the time over to you.
Okay, thank you so much, Holly. I'm Dr. Cassandra Fowler. This is my clinic, Harmony Animal Hospital. You are right now in the dog treatment area, so I wanted to show you some of our actual hospital. As Holly said, we opened in 2019. We're about to celebrate our 2-year anniversary, so we're really excited about that. Turned out opening a vet clinic right before a global pandemic worked out okay. It's a little nerve-wracking in the beginning, but a lot of people adopted puppies over that time. So that kind of gave us a good patient base to start with. So our mission is to create a loving family experience for our patients and our clients, providing top quality medicine customized to each pet's needs. And I really take that seriously, the customization part. I want to really take into consideration every patient and client's individual situation and not just treat a disease on paper. So that's extraordinarily important to us. We also focus on communication and fear-free practices. We think it's important to communicate with the client so that they're understanding everything that's going on. And then we strive to positively impact our community, operate with environmental conscientiousness, and encourage diversity in our workplace. So that is our mission statement, and we try every day to live up to that. So I want to tell you a little bit about what fear-free actually is. It was developed by Dr. Marty Becker several years ago, and the goal is to decrease patients' fear and anxiety while they're at the vet, using a variety of methods in how we approach the animal, as well as environmental techniques in how we customize our environment to each patient. It leads to more accepting patients, more compliant clients, and overall better veterinary care. It's important because fear, anxiety, and stress actually negatively impact the health of our patients. I mean, that's the same for people. It can diminish longevity, impede getting the diagnosis, and slow healing. In hospital, prolonged stress can cause anorexia, dehydration, vomiting, and diarrhea. In cats, it can cause inflammation in the bladder called cystitis, or an outbreak of an upper respiratory infection. So reducing stress is really important for the health of the patient. It's also makes the experience just better for the patient and the clients, and it's better for us too, me and my team. You know, we don't get bit as much. We don't get peed on hardly ever anymore by a scared dog or cat. So it's really a shift in the outlook that makes it better for everybody. So part of that is the design of the overall clinic. This was part of actually getting our clinic certified as a fear-free clinic, rather than just me being certified as an individual practitioner. So you'll notice, well, you might not be able to see the walls, but our walls are sort of pale pastel colors. In here, it's a kind of greenish color with tan and bluish walls. I don't wear white coats. I wear either blue or gray, you know, soft pastel colors. The lighting was very specifically chosen to be softer and gentler lighting, which is good for the patients and for the people working here. We have a lot of natural light as well. Open spaces, you know, wide open so patients don't feel cornered. We often have soft music playing. We also have white noise machines. If a patient is particularly noise sensitive, we can put a white noise machine on to help that. We use pheromone diffusers for both dogs and cats that have calming pheromones in them all over the hospital, as well as have pheromones specifically sprayed on me and all the staff. And when dogs come into the hospital, we'll put a pheromone bandana on them. When cats come in, we'll put a towel over their carrier that's been sprayed with pheromones, just to give them that calming influence as soon as they walk in the door. All our flooring was specifically chosen to be non-slip flooring. So this in the treatment area and in the exam rooms is sort of a rubbery kind of flooring. So the dogs don't feel like they're slipping when they come in the door, which is a huge anxiety for the dogs. And then we have multiple choices for where the exam might take place. So the dog in the last slide was right by the front door. She wouldn't come any further than that. And so that's where we did all our procedures. Our exam rooms, as you can see in that lower picture there, are big and spacious. Some dogs prefer to be on the couch, and that is fine, or on the chair. Some might want to be by the front door or in the corner. So we go where they're comfortable. Cats sometimes like to be high up. So we have this cat tree here that you can see with these two little kitties on it. I do their exams on the top of the cat tree every time they come in. So wherever they're most comfortable is where we try to accommodate them. And we have treats everywhere. Just treats are all over the clinic. I have a pocket full of treats at all times. And we have a wide variety of tasty treats available all the time. Then we get to the handling techniques, and I'm going to demonstrate some of those for you with our lovely assistant who is coming. First thing is considered approach. So that is where, when a patient first comes into the hospital, the staff will assess their FAS level. FAS is fear, anxiety, and stress. And we actually have a scoring system that we score each patient first when they come into the hospital, and then throughout the procedure, whatever we're working with that day, then we'll continue to monitor their FAS scores. So this is Omi. Omi belongs to Liz, who is our office manager. So Omi's very comfortable here, very happy to be here, and knows me well. And so her FAS level is a 0. She's at a very low FAS level. But I do want to demonstrate.
The camera's that way.
I want to just demonstrate, if you could take her over there, how I would approach an exam. Okay, so you can come into the room. All right, so I would come in and immediately look at the signs that Omi is showing to me. So right now she's got her back to me. She's not really making direct eye contact. And so that it indicates she's bored of me, but it could indicate that she is fearful or anxious of me if she's a dog that doesn't know me well. So I'm going to turn to the side. I'm going to get down lower on her level and offer her treats and see if I can kind of win her over and decrease her anxiety level. If she's too anxious to approach me, I'm going to be tossing treats to her. If that's not working, I'm going to up the ante and toss something, a higher level treat like a hot dog or maybe a piece of cheese. So Omi's pretty happy to take the treats from me. She's taking it in a very gentle way, so that's good. And then I'm going to start my physical exam. So I'm going to very gently, continuously monitoring her level of FAS, start petting her. And this is called the touch gradient. So once I have my hands on a dog, I'm going to try to keep them there, because taking my hands off and on can be kind of jarring and shocking. So I'm going to just keep my hands on her as much as I possibly can for the full physical exam and maintain that touch so that it's not shocking to her. And when I'm putting my stethoscope on, I'm going to keep one hand on her. Then I'm going to touch her where my stethoscope is going to touch her so that it's not scary for her. Good girl, good girl. We're going to complete the exam in that way as long as she is still a willing participant. If she starts getting nervous, then we can use distraction techniques, which I'll get to in a minute. The other thing that if we need to, for example, draw blood. So I might have a technician come in and just give gentle control, meaning I'm basically just encouraging her to stay in this position. I'm not really restraining her. Some of the distraction techniques we can use are, sorry, Alex, I'm moving out of order. This is called a licky mat. So this, I've spread peanut butter on this. It's got little nubbins. You know me. There we go. So that's a good way to make a little bit of treat go a long way while we do some of our techniques during the exam and the procedures that we need to do. We use a variety of high value treats depending on what the patient likes, and we keep track of that. So we'll write actually in their record what they like best. If she likes peanut butter, which she does, cheese, baby food. Some patients prefer hot dogs, or we have a variety of cat treats as well. Some patients, like cats especially, like to play with toys, and that helps decrease their anxiety. Some cats, or even dogs, like brushing. We had a patient boarding recently who really, really enjoyed brushing, and so we would brush the cat every day, and that really helped decrease his stress. And just giving love and attention, letting them know that we're friends and we're, you know, not somebody to be scared of. Speaking in soothing tones. We can also use something called a thunder shirt, which is a compression shirt that would go on the dog or cat and just kind of give them that hug kind of feeling to make them feel more secure. Some patients, that really makes a big difference. There's also something called a thunder cap. The dog in the first slide had this on. This is a little just a little cap that goes over the face of the patient, dogs, and decreases the visual stimulation. So it just goes over their face. And for dogs that are afraid of things or people coming at them, it can really help decrease the anxiety because they can't see so much what's coming at them. So for a lot of patients, that actually makes a huge difference. And then we also have cage muzzles, which are little basket muzzles that go on the face of a dog that we have certain patients that works well for. We can give them squeeze cheese or treats through the cage muzzle while still maintaining safety. And so if we're nervous about a patient potentially biting, then we can put that on as long as it doesn't cause them more stress to do so. And sometimes we'll actually have the owner work on desensitizing the patient and teaching them to allow having a cage muzzle be put on. Can we go back to the slide? Yes. Thank you. Okay, so more about handling techniques. We try to minimize the number of people in the room. We try to minimize stress in the room. If the patient is struggling, we're not going to restrain them for more than 3 seconds for 3 tries for a dog, or 2 seconds for two tries for a cat. And those are established guidelines laid out by the Fear-Free Committee. And if their anxiety is too high that we can't do what we want to do today, then if we don't actually immediately need to do that procedure, we're going to reschedule that appointment. And we're going to think about prescribing calming medications or supplements and rescheduling that appointment at a better time for the pet. We really try to focus on wants versus needs. So for example, if a dog comes in for their annual appointment and they need some vaccines updated and their heartworm test and maybe their nails trimmed, and we get a couple of vaccines done and then their FAS score is going way too high, I'm going to say, well, I want to do the heartworm test today, but I don't need to do it today, right? We can reschedule for next week and that will be just fine. So we really try to think long-term on those wants versus needs services to maintain a good relationship with the dog, because everything I do with this dog today is going to affect my relationship with her for the entire rest of her life coming here. She's going to remember if she has a bad experience here, and it's going to make the next visit harder. So we really want to end on a good note with her and make sure that next time she comes in, she maintains having a good experience so that we can do what we want to do. Part of the whole Fear-Free experience is really establishing a partnership with our clients and educating them on how they can participate in the Fear-Free experience as well. So good Fear-Free medicine starts at home. A lot of patients may get extremely stressed being put in the car, especially cats, being put in a carrier and put in the car and driven to a place that is unfamiliar to them. So there's a lot that owners can do at home to mitigate the stress that their pet is feeling before they even get here. They can play soft music in the car. They can use pheromones in the carrier and or the car as well. They can bring along things that are familiar to the patient, blankets, treats, toys. That one cat brought the brush because the owners knew that the cat really enjoyed being brushed. So we'll talk about that with owners on the phone before they even come in, give them instructions on how, especially if we know their patient is stressed out. Do they have the medications or supplements that they need in order to successfully bring their pet into the hospital? And are they doing all these other things to help their pet be as low stress as possible? And then afterwards, going home, so recoveries from surgeries or sedations, reintegrating pets to the household when there are other pets at home. Sometimes that can be a stressful experience because, especially again with cats will smell a strange environment on that cat, and they can get stressed out with each other. So there's things we can do to mitigate that. And then if an animal showed anxiety with a specific procedure in the hospital, we can teach the owner how to start desensitizing them to that at home. For example, cleaning the ears. We can show the owner how to desensitize and counter condition their pet to actually make that a positive experience so they can accomplish that at home. And if we need to do it in hospital, then in the future we can do that as well. So some more about just our general services. Obviously, we do well visits and sick and emergency visits during our hours of operation. First puppy and kitten visits are extremely important to us because they really set the tone for that patient's life with us and potentially other vets as well. So we take a full hour with that first appointment. We really help acclimate the pet to our hospital and our staff. And we talk to the clients about nutrition, training, socialization, and everything they're going to need to set up their pet for success. And we start the vaccination schedule and set up how that's going to proceed for this individual patient, which vaccines are going to be necessary, and what the schedule is going to be. Behavior consultations are another service that we offer. That's also usually an hour-long appointment. I use a comprehensive approach. So we talk about medication therapy when appropriate, but we also talk about behavior modification techniques that the owner can work on at home, environmental modification recommendations, and sometimes dietary changes or supplements as well, to really take a sort of holistic approach to any behavior problems that have come up. So separation anxiety, which is a big one as people are going back to work after COVID. Noise and storm phobias is always a problem in the summertime. Aggression and biting, we try to find out what's the underlying cause for that and how can we mitigate that. Some animals are particularly territorial and that becomes a problem. And cats can have litter box avoidance problems due to a variety of stressors going on. So there's a lot of things we can do to mitigate all of that. We provide dental services. So we have a strong belief that dentistry, dental health is important for the overall health of the patient. So we really try and be proactive on dental care for our patients. We have dental radiographs that are included with all our dental cleanings, and that allows visualization of the tooth roots, which is 60% of the tooth being under the gum line. So that's extremely important to see and a critical component of evaluating their dental health. And actually, I have over 15 years now of surgical experience, and I do a variety of soft tissue surgeries and a few orthopedic surgeries as well. And then any complicated cases, we are very lucky to live in an area with a variety of excellent specialists in our area that we can refer to as well for complicated cases. For patients that we have in hospital, both postoperative patients or sick patients that need hospitalization, our highest priority is still their comfort and safety and managing their stress level. So we do all of the things that we have already talked about, as well as patients recovering from surgery. They'll get wrapped in a warm towel. We may have a room warmer going on to help keep them comfortable. Keep the noise levels to a minimum. We have for both dogs and cats separate recovery areas that are completely isolated from the exam rooms and the rest of the treatment areas, so that they're not disturbed by the noises going on in the rest of the hospital. And if necessary, calming supplements or sedative drugs can be also used to help them relax and maintain their comfort level. A few other interesting services we offer. Stem cell therapy is really cool. We collect a small portion of fat from the animal, send it to a special company that isolates the animal's own stem cells, and then sends it back to us. We can use that to treat arthritis as well as a variety of other options for other diseases, such as inflammatory bowel disease. I've treated one dog with IBD. I treated one cat with kidney disease, and both are doing very well. And there are other diseases always in the works that they're developing new treatment strategies for that as well. It's really cool. We have a therapy laser, which is fantastic. We use it all the time. It uses a specific wavelength of light that has been proven to decrease inflammation, decrease pain, speed healing, kind of activate the healing cells. So we can use it for chronic conditions like arthritis, pancreatitis, gingivitis, cystitis. We can use it for more acute conditions like wounds and ear infections. we use it in all our surgeries and our dentistries. And for some dogs, dogs and cats, we have them coming in for their regular laser treatments. We offer packages for that, particularly for the more chronic conditions. So it can make a real difference for them. We have an acupuncturist who works with us on Fridays. She is amazing. Acupuncture is, a thousands of years old treatment modality, and it just provides sort of a holistic approach to the options that we can offer our patients. And we have boarding facilities as well. Right now, we only have our cat boarding open. COVID has really placed a damper on opening our dog boarding. We have not opened that service yet, but we will eventually. So we try to maintain the same level in our boarding facility of FAS control as we do in the rest of our hospital. So they use pheromone products, they get blankets and bedding, and we have soft, relaxing music in the cat boarding room. They have playtime and treats as needed, and we can give them supplements as well if it helps them to maintain a lower stress level. We have grooming. We have a grooming department. We do not currently have a groomer. We are on the hunt for a new groomer. Our wonderful groomer moved on, but our groomer is, when we have one, fear-free certified as well. And so you can see this dog on the side picture there. That dog was very noise sensitive, so that's called a happy hoodie that's on her. And it just covers her ears to decrease the noises of the grooming room, the dryer and that kind of thing, the clipper noises that are going on in there to keep her happy while she's in the bath. And then I have a few success stories, fear-free success stories to tell you about. This is Coco. When she first came to us, she was an extremely nervous dog, just the kind of dog that just is almost climbing the walls trying to get away from you. Not aggressive in any way, very sweet, but just extraordinarily scared to be here. She also had been just diagnosed with heartworm disease. So the treatment for heartworm disease is a series of painful injections. After each injection, they have to stay in the hospital for the full day for monitoring, and their heart rate needs to stay low because as the worms in the heart are breaking up, we can't have the heart rate increasing too fast, breaking up those worms too fast, and then shooting them out into the blood supply. So it was quite a challenge to treat Coco. We had her pretty heavily medicated for the heartworm treatments, both for pain and for her anxiety. And she was too nervous to go in a cage in our recovery area. So we set her up a little bed beside the office manager's desk in the middle of the clinic where we could all see her. And she came to know that that was just her area. And she just stayed there and was happy to be covered in her little blanket and eat treats and get petted. And each time she came in for her injections, it went better and better. She's now heartworm free, and she's still an anxious dog. We still have to medicate her if we're going to do any major procedures, but I can do a thorough physical exam on her. She's happy to come in the door. She's happy to see us. And it's just made a huge difference to see Coco grow in that way, even through the horrible process of a heartworm treatment. So that was really great. Then this is Benny. Benny was adopted as an extremely anxious dog and had a lot of aggression with people he didn't know. He would growl and bark at us. He absolutely would have bitten us had we tried to push him at all. So we started Benny on a schedule of happy visits where he would just come into the hospital on a regular schedule, and the staff would all give him treats and encourage him to allow a little bit of petting at a time, a little bit of scratching here and there. And he's doing fantastic. He doesn't even need medications to come in for his happy visits anymore. He's excited to come in and to see us. And I have been able to do a full exam on him as well, which is a huge, huge success. And the owner's very thrilled with that. And then this is Money Cat. Money Cat is, she's your classic cat that is happy until you try to do something, make her do something she doesn't want to do. And then she gets very, very cranky very fast. And she was in a lot of pain from arthritis as well. So that contributed to her anxiety and stress, of course. So I prescribed a regimen of laser therapy for her, but we weren't sure if that was going to work because we weren't sure if she was going to allow us to keep her in the position necessary to laser her knees. But we let the owner stay with her and support her, and she really quickly started to relax and enjoy her treatments. She realized that felt actually really good, and she is moving better now and walking better and happier in general to be here when she does come in. So we're really happy to see that as well. So that is my presentation. Does anybody have any questions?
I have a question.
Yes.
Separation anxiety. How do you know that your dog has separation anxiety? Because obviously with COVID and everything, it's been, shoot, I mean, 20 months since our dogs, we have left them alone, but yeah. I mean, it's going to be continually, once my son goes back to school, it's going to be continuous every single day. How do you know?
Absolutely. So there are several signs of separation anxiety, destructive tendencies. It's sometimes you don't know, but if your dog is whining or crying while you're gone, then that, if they are refusing to eat while you're gone, when normally they would eat throughout the day. If you get home and you realize, oh, they haven't eaten that treat that I left them, that's anxiety. Or not drinking during the day. Urinating or defecating in the house when they wouldn't normally do that. So lots of signs that your pet's unhappy. If they're starting to show signs of anxiety while you're getting ready in the morning. So when you're putting on your shoes and picking up your keys, if they're running around, getting stressed, you know, trying to come with you out the door, that kind of thing, that's a huge sign that they're not going to be happy when you're gone. Or when you get home at night, sometimes super exuberance when you get home at night can indicate that they've been stressed all day. So yeah, lots of signs and lots of stuff we can do about that. But one important thing is to start working up now before the real schedule starts, right? Start working them in small increments to leaving the house, like you were saying that you're already doing, to get them comfortable with this is going to happen. It's okay. And leaving them, you know, treats and fun, perhaps food puzzles, things like that to do while you're gone. That can help. But sometimes it takes medication too to get them over that hump.
Thank you.
Mm-hmm.
Dr. Fowler, this is just wonderful information. Thank you so much. It makes me wish that my doctor took as good care of me as you take the pets that come into your hospital.
That way. Thank you.
I think, I know if other people have questions, they can contact you directly. We have your email.
Yes.
They could reach out to you, but this, I am so impressed with the range of services that you offer there. And, you know, just your whole approach to taking care of these wonderful pets. Thank you for sharing your time and all of this with us.
Thanks, Holly. Thanks, everybody.
Does anyone have any more questions before we end this?
I'll just say one thing, a testimonial. We have 3 pets now. We have a small Yorkie, a golden doodle, and now my daughter got a cat. And they are all go to Harmony Animal Hospital, and everything that she says is accurate. They like walking in there. They are very calm. They enjoy being there. They actually get mad when the nurses and the vets leave the room because when they come back, they don't even want to have to deal with their owners when they're there. So everything that they say is true. And I just want to give that small testimonial. So.
Thank you, Ken. We appreciate that. That's great. Well, thank you so much for joining us for Thursday at noon. Thank you, Dr. Fowler. And this video will be posted on our website in a couple of weeks.
Okay, fantastic. Thanks so much, Holly.
All right.
Gosh, and
Bye-bye.
Bye. Good to see you guys.